You have been living with a deep, burning pain in your lower back and a terrifying electrical shock shooting all the way down your leg to your foot. You finally undergo a magnetic resonance imaging scan. A few days later, you open your medical portal to read the radiologist's report. You are hoping for a simple answer, but instead, you are faced with a wall of terrifying medical jargon. You see words like broad-based bulge, focal protrusion, extrusion, and sequestration. You do not know what these words mean, but you assume that your spine is completely destroyed. You search the internet for answers, and you find hundreds of conflicting opinions. Some people tell you to rest. Others tell you to stretch. Some tell you that you need an immediate spinal fusion. If this is your reality, you must take a deep breath. You are trapped in a medical language barrier. Today, we are going to translate your MRI report. We will break down the exact mechanical differences between the 4 stages of a dying spinal disc, explain why your leg feels like it is on fire, and show you exactly which surgical or non-surgical tool is required to fix your specific stage of damage. To understand your MRI report, you must first understand the mechanical engineering of a healthy spinal disc. Think of your spinal disc exactly like a heavy-duty, pressurized car tire. The disc has 2 main parts. The outer wall is called the annulus fibrosus. This is a thick, highly durable ring of collagen fibers, acting just like the thick rubber tread of a tire. The inside of the disc is called the nucleus pulposus. This is a soft, highly pressurized, water-filled gel. In a healthy spine, this pressurized gel pushes outward against the thick rubber wall, providing the perfect shock absorption every time you walk or jump. But as we age, or if we suffer a mechanical trauma like lifting a heavy box with terrible posture, this perfect hydraulic system begins to fail. The outer rubber wall begins to dehydrate, weaken, and develop microscopic cracks. The immense physical pressure of your body weight begins to force the internal gel into these cracks, pushing the wall outward. Radiologists classify this structural failure into 4 distinct stages of severity. Your treatment options depend entirely on which stage you are currently in. The first stage is called a disc bulge. Returning to our car tire analogy, imagine a tire that is low on air. Because it lacks internal pressure, the entire outer wall of the tire sags and bows outward symmetrically. On an MRI, a bulging disc looks like a hamburger patty that is slightly too big for its bun. The outer wall is intact, but the entire disc is pushing outward. This is often a normal sign of aging, and unless your spinal canal is naturally very narrow, a simple bulge rarely causes severe sciatica. The second stage is much more dangerous. It is called a disc protrusion. In this stage, the internal gel aggressively pushes into a specific, weakened spot in the outer wall. The gel does not break through, but it creates a highly localized, sharp tent or blister on the outside of the disc. Imagine squeezing a water balloon until one side bubbles out sharply. This sharp blister pushes directly into the spinal canal. Because the blister is firm and highly pressurized, it acts like a mechanical clamp, physically crushing the delicate spinal nerve root against the surrounding bone. This is when the severe shooting pain down your leg typically begins. Now we enter the critical failure zones. Stage 3 is a disc extrusion. In this stage, the mechanical pressure becomes too great. The outer rubber wall completely tears open. The pressurized internal gel violently breaks through the barrier and leaks directly into the spinal canal. This creates a massive medical emergency. Not only is the leaked gel physically crushing the spinal nerve, but it also triggers a massive chemical fire. Because the inner gel is highly toxic to your immune system, leaking it onto a nerve creates a condition called chemical radiculitis. Your nerve is being simultaneously crushed by pressure and burned by acid. The final stage is stage 4, called a disc sequestration. This is the absolute catastrophic failure of the disc. The outer wall is ruptured, but the damage goes one step further. A large fragment of the internal gel physically breaks off and separates entirely from the main disc. This disconnected fragment acts as a loose migrating boulder inside your spinal canal. It can travel up or down the spine, lodging itself deep inside the nerve tunnel. A sequestered disc fragment often causes the most agonizing, paralyzing pain possible, and it completely alters our surgical approach. This 4-stage reality exposes the massive danger of generic physical therapy and chiropractic adjustments. When a patient has severe sciatica, they often go to a local clinic and are told to perform aggressive spinal twists, or they are placed on a mechanical traction machine that violently stretches the spine. If your MRI shows a stage 1 bulge or a stage 2 protrusion, gentle traction might provide temporary relief. But if your MRI report says you have a stage 3 extrusion or a stage 4 sequestration, aggressively twisting or stretching your spine is a devastating medical mistake. The outer wall of your disc is actively ruptured. If a chiropractor applies high-velocity rotational force to an extruded disc, they will physically squeeze more toxic gel out of the hole, exactly like squeezing a tube of toothpaste. If you have a loose, sequestered fragment floating in your spinal canal, stretching the spine can push that fragment deeper into the nerve root, instantly worsening the nerve damage. You cannot apply generic physical movements to a ruptured biological structure. Because the 4 stages of herniation are mechanically completely different, we cannot use a one-size-fits-all surgery. We must perfectly match the surgical tool to the exact millimeter of failure shown on your MRI. If your MRI proves you have a stage 2 protrusion, we have a pristine, unbroken outer wall. We completely avoid open surgery. We utilize percutaneous laser disc decompression, or PLDD. Under local anesthesia, we guide a microscopic laser fiber into the center of the disc. We evaporate a tiny fraction of the internal gel. This lowers the internal pressure and creates a vacuum effect. The vacuum physically pulls the sharp blister back inside the disc wall, instantly releasing the clamped nerve. However, if your MRI report says stage 3 extrusion or stage 4 sequestration, the laser is completely obsolete. A vacuum cannot pull back a piece of gel that is already broken off and migrated down your spine. For a ruptured disc, we must use transforaminal endoscopic spine surgery. Through an incision smaller than a coin, we insert a high-definition camera directly into the spinal canal. Looking at a highly magnified monitor, the neurosurgeon navigates around the delicate nerves. Using microscopic graspers, we manually locate the leaked gel, grab the toxic sequestered fragment, and physically pull it out of your body. We clean the chemical fire from the nerve root, preserving the healthy structures of the spine without using massive titanium screws. Many patients suffer in chronic agony because they are paralyzed by the confusing medical terminology on their MRI report. They allow local doctors to give them endless steroid injections that fail. Or worse, they agree to a massive, outdated open spinal fusion simply because they do not understand their options. Let us look at the true cost of getting this wrong. If you allow a clinic to perform a very expensive laser procedure on a fully sequestered disc fragment, the procedure will fail entirely. You will lose your money, and the pain will remain. Conversely, if you allow a surgeon to perform a massive open laminectomy for a simple stage 2 protrusion, you are destroying your healthy back muscles and risking a lifetime of scar tissue for a problem that could have been fixed with a 15-minute laser procedure. You are risking permanent neurological damage or permanent surgical trauma because your doctor failed to match the right tool to the right stage of your disease. If this video helped you understand your MRI report, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution to your pain. But you cannot fix a mechanical spinal problem by guessing, and you cannot properly analyze an MRI by asking questions in a comment section. Do not just read the terrifying paper report. Every spine is unique. Click the localized link in the pinned comment or the description below to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your actual imaging files, decode the exact stage of your disc herniation, and build your personalized treatment plan. Stop living in fear of medical jargon and stop treating the wrong anatomy. Let us find your exact solution today.